Right, so let's start with the coronavirus situation in the nation. South Korea has reported its highest number of new COVID-19 cases for a Sunday by the 9 p.m. cutoff time. Critical cases remaining above 1,000 for 2 days in a row now. And as the country hunkers down during this difficult period, schools in the capital area are also winding back their in-person learning due to the latest surge.
For more COVID-19 related updates, we have our reporter Kim Yeon-seung here in the studio. Welcome, Yeon-seung.
Good to be here, Mokyeon, Mark.
Now let's start with the COVID-19 situation here in South Korea.
Well, Sunday's late-night COVID count hit a new fresh high, close to 5,000 cases by 9 p.m. The caseload jumped by more than 300 from the same time last week. So when the total tally rounds up, it's highly likely that this number will reach over 6,000.
Ryan, tell us more about the critical caseload, because that's been in quadruple figures now for 2 days in a row, and this has put an enormous strain on the healthcare system.
Exactly. So the critical caseload on Sunday has also topped 1,000 for 2 days in a row. The medical frontline is really feeling the strain of the hike in critically ill patients. Nationwide, only 2 out of 10 ICU beds are left, and for days straight, more than 1,000 patients had to wait more than a day for beds. And this overload in the COVID-19 sector is actually affecting the entire medical capacity. In Gyeonggi-do province, there was even a case of a pregnant woman who had to give birth in an ambulance because there were no beds left to accommodate her in all of the 16 hospitals in her vicinity.
While the bed shortage problem is becoming even worse by day. Now, aside from that, Yeon-seung, what about cluster infections? Are we worried about some cluster infections here in the country?
Well, there has been a worrisome cluster infection in a prison facility in Chungcheongnam-do province. 12 infection cases were detected last Friday with 57 individuals now confirmed, including 54 inmates and 3 staff. The nation already experienced prison-wide infections last year, with more than 1,000 inmates and staff becoming infected because of the dense and poorly ventilated conditions at prison facilities. So this time, health authorities are really focusing on taking control of the spread before it escalates into a repeat scenario. Today, they're launching a 4th round of COVID-19 testing in the prison to comb out more infections, if any, and a second stage of nationwide testing for 17,000 prison staff to see if there are any cluster infections to be worried about in any other prisons.
Yeah, it's certainly a worry if the prison staff start getting ill with COVID, because they have to be there to make sure the prisoners are not acting up. And in terms of the hotspot is still clearly Seoul in this case, but what about nationwide policies? Are we seeing anything changing for the entire country as a result of this surge?
Well, schools in the capital area are reverting back to remote learning. So this comes only 4 weeks after they opened school gates wide to all students. First and second grade elementary schoolers can come into school every day, but there is a 3/4 attendance cap for 3rd to 6th graders. For middle and high schoolers, there will be a 2/3 attendance cap for the entire student body. But outside the capital, each region is going to take their own approach. For example, the cities of Daegu and Gwangju will stick with in-person learning.
Now, Yeon-seung, let's talk about Omicron. What do we have? What's the latest?
Well, so far, South Korea has confirmed 178 Omicron cases in the nation as of Sunday. And 4 of these cases turned out to be breakthrough cases among those who had received their booster shots. 2 of the infected had received Johnson & Johnson jabs, while 1 had completed their shots with AstraZeneca and got their Pfizer booster, and the last had all 3 shots of Pfizer's vaccine. All 4 of these cases reported mild symptoms. Although it's been proven that there's still a risk of an Omicron infection for booster shot receivers, experts are still asserting the importance of getting the 3rd shot because it significantly brings down the likelihood of an infection from turning into a serious illness.
Right, and how are health authorities here in South Korea going about treating the patients that we know have this Omicron variant? Are there any kind of modifications being made there?
Well, the Omicron is particularly worrisome because, as I reported before a few weeks ago, there's been preliminary studies about how the current methods of COVID-19 treatment may be less effective against Omicron. Well, further studies continue to show results in tune with these earlier studies, and there's a possibility that the methods of antibody treatments that we have on hand from Regeneron and Eli Lilly may be sidelined as the Omicron spreads. Another antibody drug from British drug maker GlaxoSmithKline may rise as the most potent treatment against Omicron. But since this drug isn't as widely used, there may be a supply shortage.
All right, Yeon-seung, thank you so much for your report. We'll talk to you again tomorrow.